The other thing that can affect cognitive functioning is mood. So Mark, how do you think about that and the effect of mood on cognitive functioning?
It's so important, as has been discussed, to look at some of these risk factors because you might be dealing with reversible changes in cognition, and it's wonderful when you can really have an impact on someone's life by identifying a factor like that and addressing it, and they're better. Sometimes it's the cause of what's going on. Sometimes it's just worsening it. So mood is a good example. Severe depression can mimic dementia. There's a condition called pseudodementia, where individuals, usually an older individual, looks like they have an early stage of Alzheimer's disease or some form of dementia. They don't have good motivation, there's personality changes, they're just slowed down in general. But what's really going on is an underlying depression, and when you treat the depression, they get better and the cognitive changes go away. That's good news on one front, but we also know that probably up to a third of these individuals, this is actually a prodromal stage of dementia, so we need to follow them very, very carefully over time because their risk of developing an actual dementia is quite high. But it really speaks to the impact of mood on, not only as a risk factor, we know chronic depression, especially later in life, is a risk factor for developing dementia, possibly because of the effect on increased cortisol rates on brain cells. But in addition, someone who's depressed is not taking as good care of themselves. They might be missing medications. It can have impact on cardiac function. That can increase the risk of cardiac events, of stroke. So it might be direct or indirect, but that link is really clear. And I would add as well, so many of the individuals I work with who have dementia, when they're depressed, they do worse. Their function is worse, they're not socializing as much, they're clearly suffering more. And so by treating the depression, we really have a great impact on them, and we have a great impact on the caregiver. And caregivers, we know, also suffer from higher rates of depression. And so they also need to be factored into the equation and often need treatment as well.
Right. And I should have actually said depression and then also anxiety, because that's the other part of the issue, where we all know that we hear stories from our patients that things that they used to do routinely now cause them anxiety, travel, appointments, and it seems that at that point, cognition seems to just bottom out.
It's true. For any of us, if we were beginning to have more difficulty organizing our day, we're going to be more anxious. So that's a given. But when you think about it, part of addressing anxiety is our internal scripts in which we're able to put things into perspective, we're able to organize things, come up with a plan to try to reduce anxiety. But when that function, especially those executive functions, are waning, and a person is less able to do that, the anxiety can peak. It can evolve into frank panic attacks. And that's why sometimes we see these exaggerated responses to stress from individuals that in the past we never would have seen that. That's anxiety. The good news is that we can treat it. We have lots of different ways to address that. But it can be such a form of suffering for someone. And so it's so important that we really readily jump in and help them with that.
So I think the take-home point is that there's the pseudo-dementia, and also due to, I guess, anxiety and also depression that is treatable in many. And there's also pseudo-depression, which is a manifestation of a brain disease like Alzheimer's disease that can be a prodrome for many years. So either way, if you think about anxiety, depression, mood changes in an older individual, we have to think about doing cognitive assessment.
It's true. Yeah. And clinicians need to understand the difference between depression and apathy, because apathy is a disorder of motivation, depression is a disorder of mood, and the two can look identical, but knowing the difference can make all the difference in terms of clinical approaches to it.